Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Ryan here with us today, and Ryan is 2 weeks, isn't it now, post-surgery? And he had a torn rotator cuff, and he also had a spur on his acromion process, which they clipped off too, right?
Yes.
So he's really, this is his first time being treated post-surgery, if I'm correct.
Yes.
And we're going to do a case study with him utilizing the rapid release technology, high frequency vibration, to break up the scar tissue and adhesions that are currently forming in his left shoulder joint as a result of the surgical intervention. And we're going to do each one of his treatments that way, so you'll see a progression throughout time and take how much time to get him back into where he's feeling like he can do his normal stuff, which, as you can tell, he's a weightlifter, an athlete, martial artist. So let's take a look at you here then, right? And you can see he's been wearing a sling, see how he's carrying his arm. Okay, let's have you flex your head forward and then backwards for me. Movement is the key to rehabilitation, so we're going to start passively moving his shoulder and also doing the deep high-speed vibration on it so that we get a breakdown of the scar tissue. It also resonates with the nerves, so it will actually help the nerves heal up quicker in there too, which will reduce his pain. Okay, so we still analyze his posture, even though you can see he's carrying his arm. Now, see, that's what happens if you wear a sling too long. Once you take that sling off, you can't even move your elbow or your shoulder or arm or anything because it heals up with fibrotic scar tissue and adhesion. So, okay, Ryan, let's go ahead. We're going to decompress you still. And he's, been laid up, so he's having some back pain, soreness, and neck pain, soreness. Not good just to lay around, is it?
No, sir.
And that's not like you either.
No, sir.
I read up on all the protocols and stuff on this yesterday for doing this. We are ready to get it going. Oh yeah, good. Feel it all the way through?
Yes, sir.
Good. Well, that had to feel good first time in a couple of weeks.
Very good, yes, sir.
Alright. There are a few patients that we actually have to refer out for surgery, like Ryan. And we only work with the best orthopedic surgeons and neurosurgeons in the city. Pain management docs if necessary. We don't do that too often, but sometimes. But if there's a problem that I can't fully treat or rehabilitate, then we do refer out for surgical intervention if necessary. We just referred a guy out for spine surgery to a neurosurgeon here in Houston recently because he had spinal canal stenosis and was starting to get caught Aquinas syndrome, which is where the bottom portion of the spinal cord flares out. It's called the flume terminalis. Let's go ahead and go in your tummy for me, Ryan. But just because of the position of his arm, we're going to be real careful up in that region not to bump into it and hurt it. But his left leg's coming up short, and I bet you that tightens up in your low back right there.
Yes, sir.
Ryan, see if you can lay your arm down there and rest that, kind of relax that on there like that other one. Does it hurt to bring it down that far? To rest your arm on there? So we're going to adjust his SI joints first. Good job. Well, that moved good. Yeah, I'm going to put your head down just a little There we go, good. Okay, this should be even now, which it is, and this should feel a little bit easier already, Ryan.
Oh, much easier.
Okay, good. So I'm not going to cut him any slack on the lower back and pelvic area. We are going to do turbonator on that part. Sorry, Ryan. There we go. We got all kinds of tools in here that are very beneficial for breaking up scar tissue and adhesion. He's pretty sore throughout his paraspinals in his thoracolumbar spine region, but that's just from not being moved and adjusted in a few weeks and probably laying around a little bit more following the surgery. So now we're going to use the rapid release technology on his entire paraspinal muscles. You can see I just have to hold that by 2 fingers. And we're not applying any downward pressure at all. We're just letting the machine itself do all the work, because it sends vibration deep down into the tissues. And I'm doing his right side first, just to kind of get him the feel of it before I start working my way over into that left paraspinal area and shoulder girdle area. It's a lot different than the other one, doesn't it? Every patient that we've used this on so far that we've seen since Monday has had phenomenal reports of feeling much better following getting this done. Now I'm working out in the trap up in this area here, because the scar tissue proliferation is extensive when you have surgery. It's got these different heads on here too, which I like, which are more focused. And you'll be able to see the areas where he's had more soreness and trigger points. Got it right in here between the shoulder blades. Between the shoulders. Yep. Pretty intense, huh? Yeah, this gives you a white knuckle syndrome too. Alright, Ryan, what I'm going to do though is I'm going to have you sit up and take your shirt off for me and face towards Renee if you would. It's kind of hard to do stuff like this with one arm, huh?
Yes, sir. This arm first.
Yeah. There we go. Pull that off easily. There we go. Good.
Sit that way?
Yeah, please. So I'm going to work this right on your left shoulder. And then lift your chin up. There we go. Very small incision side, so that's good. And then it's not open wound, so we're not doing this over open wound. Right now we're working on his trapezius, but we're going to Get down into his rhomboids, in between his scapula and the spine. And then back here on the posterior delt, he's probably going to start feeling a little bit more. And then we're going to get back into his teres major and minor muscles right in here. And then we're going to work our way around into his lateral deltoid, getting closer to the incision sites up front. You feel that deep down in there, Ryan?
Yes, sir.
Now we're going to do the anterior deltoid. We're going to come right up over that scar tissue and very, very lightly go over that area. It's probably going to feel a little bit funky here at first.
That's good.
Yeah. That's what everybody said so far. Now I'm going to use this little knob tip on here so it's a more targeted vibration. You really feel it right around your scapula here, huh? This is probably, you really feel it right here in the teres major and minor too. Posterior delt. Yep. See, we can just follow his delt. His is a little easier to follow because he's more defined. Right on his lateral deltoid now. And again, we're just doing this very lightly. We're not applying any pressure to it at all. I'm going to come up in the front here and do this right on his anterior deltoid and his pecs. Right in through here. Now I'm going to passively move his arm slowly. Go ahead and just stretch your elbow out a little bit. And you tell me if it gets to a point where it's unbearable for you. We're going to try a little abduction while we're doing this too, which is straight lifting up. And I'm doing all the lifting. He's not activating his muscle at all. And we need to do this to remodel the scar tissue fibers, the adhesions, the fibrinogen and collagen fibers that are being laid down right now will conform to the lines of tension and stress being put on them over a period of time. That's Davis's law, and that's found in Syriac's research, famous orthopedic surgeon that did a lot of the soft tissue rehabilitation research. If I don't send off your tattoos. Okay, so we're going to slowly bring it backwards as well. And notice I'm straightening his elbow out simultaneously, and we're going to be working on his triceps here as well. As if he were to go 4 to 6 weeks wearing that sling, the only thing he'd be able to do with his left shoulder and arm at the end of that 6 weeks is hold it the same way the sling's holding it. Because the scar tissue would actually freeze it in that position. Now I'm coming right around the outline of that posterior deltoid now and into his tricep, while I'm extending his shoulder backwards and also simultaneously abducting or bringing up his left deltoid. I'm going to use a bit broader head here now. There we go. That's the straightest you had your elbow, I bet, since you had the surgery.
Yes, sir. This feels pretty good.
Yeah, his rehabilitation process should be accelerated by 3 to 4 weeks by doing this. There's going to be some sore spots in there here at first, but Ryan's a tough cookie, and this won't do anything to damage the surgery or anything that was done in the surgery, because this is only creating a frequency down into the soft tissues. And I'm going to go ahead and let it back down on the deltoid, and we'll keep increasing the passive range of motion as we get along in this. The delta, or your pecs are a little sore too right here, huh?
Yes, sir.
This is a rapid release Pro 2 model sold by Rapid Release Technologies. We just acquired this to do specifically for this kind of stuff, and also for post-injury patients too. Okay, so now I'm going to passively abduct this shoulder and posteriorly rotate it and straighten out that elbow a little bit more, because we want him having a full range of motion in all of his joints following this procedure. Okay, and that's actually quite enough for the very first time. But Ryan, why don't you, I know you're not supposed to actively move that shoulder too much, but just try to move around a little bit and see if that feels any looser or any less painful than it did prior to you coming in today.
Actually, yeah, it does.
Yeah. That's better already, huh?
Of course, I moved it in 2 weeks.
Yeah. So that's the most he's moved it since he had his surgery, which is good. Okay, so we're going to be following Ryan's progress here over the next few weeks, and we'll be actually videoing and cataloging every single session so that we can see the improvement. This is going to be a case study on posture or rotator cuff tear surgery, post-surgical rehabilitation, and advanced chiropractic relief. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.